11:49 a.m. We are back on the record, and this is the beginning of tape number 2.
Doctor, question about your testimony yesterday. You had testified about things that you felt were a violation of the protocol, and what I just want to make sure I'm clear on is that when you were testifying about that, you meant a violation of the clinical trial agreement as opposed to Dr. Lazaroff's own protocol.
Both. The protocol of the Sargon methodology for placement of the Sargon implant and what's written.
Are they the same?
They're supposed to be No. The Exhibit B is the research methodology, what we call the protocol of the study. But there are also the protocol of the Sargon implant. So technically, when you want to test any method, any material in the market, you have to follow the instructions of the developer.
And in the clinical trial, was that done?
No.
What part was a violation of Dr. Lazaroff's protocol, separate and apart from the clinical trial agreement?
Yes.
What was it?
Okay. The admission of some patients, if based on what we heard.
That's in your view, a violation of the clinical trial agreement.
The clinical trial
agreement, or the Appendix B.
Yes.
Okay.
Yes.
That's not
the use of osteotome. That is not in the Sargon system.
Now that's a violation of Appendix B.
Yes. Appendix B and the Sargon system protocol.
What I'm trying to find out if there are things that you feel were a violation of the Sargon system, but may not be a violation of Appendix B, or are they all the same?
Appendix B must, by definition, follow the Sargon system.
So, in essence, you were saying they were a violation of both?
Yes.
Okay, that's what I wanted to clear up.
Yeah, right.
If during the course of any of this you think there's something that may not be contained in Appendix B but is in the Sargon system and wasn't followed, maybe you can let me know.
Okay.
All right. Now, before we took a break, I was asking you about complaints and concerns you had heard about the study between November 1996 and August 1997 when you left for Saudi Arabia. And we talked about the delay. I think we've covered that. And then you mentioned with respect to some graduate students and the restorative work they were doing, correct?
Correct.
All right. And anything else?
That incident concerning my dental assistant.
With Dr. Handelsman?
Yes.
That was in this time frame?
Yes. That the patient was seen by somebody who's not involved in the study.
Anything else?
No.
Now, I take it that you had not received from Dr. Lazaroff or anybody else any complaints or concerns about the exclusion criteria not being followed during that time period. Am I right?
That is correct.
So we have three things: restoration by graduate students, delay, and Dr. the incident supposedly involving Dr. Handelsman. Now, I think I asked you earlier who you communicated these concerns to, and you told me Dr. Landesman, right?
That is correct.
And